I would say that the pandemic has had a significant impact on people's mental health and wellness. What I've seen in my patient population is that individuals who already have pre-existing mental health conditions, those conditions have worsened due to the effects and the stress of the pandemic itself.
In the past year since the pandemic, I have seen a rise in depression. I have seen a rise in anxiety. Just related to the situations that are happening. I have seen families just go from having to not having at all. Families just feeling like, what are they going to do the next day?
So this past year was especially challenging for our CrossOver families who have students. There was quite a learning curve, literally, in helping them adjust to one day hearing that school was closed for 2 weeks and then essentially being closed for the rest of the year.
The beginning of the pandemic, before March 2020, we would receive 600, 700 calls a week. And now, April 2021, we have been receiving 1,500, 1,600 calls a week.
I think that social work is integral with healthcare. In the social work profession, we operate from something called the biopsychosocial spiritual assessment, in that we're taking into account all of these areas when we work with our patients. So the patient who might be sitting in the office in an appointment with me is not the end of the patient that I help with. If that patient is married or has children or extended family or is having trouble navigating the systems in the community, social work can help with all of that.
We have integrated care here at CrossOver, and what that means is that the medical team and the mental health team and all of our specialties in social work, we all work together to kind of work around the patients and kind of provide a circle of care with the patient. Recognizing that we aren't just, bodies, we're also minds, is very important in how we treat the whole person.
Everybody had to face the unknown with the pandemic, but if you consider what it would be like to be pregnant in the midst of that unknown, that's a lot of added stress because it's not only yourself that you're worried about, but your unborn child. I think the OBT team was really innovative in the way that they came up with a hybrid telehealth and in-person visit schedule so that we were minimizing how many times our pregnant patients had to come into the clinic, be in contact with lots of other people, but at the same time we were able to maintain continuity of care throughout their pregnancy and see them in person when they needed to be seen the most.
Before the pandemic, patients would miss appointments, and when we'd ask them why they missed appointments, they would be like, oh, I couldn't get a babysitter, or I didn't have gas money, or other barriers. And by converting our services to telehealth, we actually have removed barriers for clients, and clients have been able to get services on a much more flexible schedule in a way that works for them. There is not one particular patient profile or one particular type of patient that is likely to need mental health services at CrossOver. The need for mental health services can't be, split down by gender or race or age. All patients at any point in time could need mental health services at CrossOver.
They should know that there are resources out there, that even when they're going through the worst of situations, that we are here to help them, that CrossOver is here to help them.
So thanks to CrossOver, rent has been paid, food has been served at home, students have had access to the internet and laptop devices in order to attend school virtually. For me, the biggest role that social work has been able to play here at CrossOver is to be an advocate, to give a voice to our families who otherwise wouldn't have been heard and whose students might have been completely left behind this year.
We really focus on relationships with our patients, and that puts us in a good place to be able to provide mental health care.
CrossOver is hope. In a time where hope has been lost, in a time where people just don't know what to do, I think that we have been like a beacon of light in the community.
CrossOver is here to help.